Welcome to Pediatric Pioneers, a MedBridge podcast where we conquer challenging topics for the pediatric therapist through conversations with pioneers who have blazed new trails in our practice. Our aim is to deliver actionable takeaways for practitioners like you. To receive continuing education credit for this episode and access bonus resources, make sure you check out medbridge.com. Hello, I'm your host, Nicole Schwam, and I'm an occupational therapist with over 20 years of experience in practice and academia, specializing in pediatric practice and the improvement of occupational participation and performance through my expertise on executive function, visual perception, social emotional learning, sleep, and sensory processing. It is my passion to support pediatric therapists like you so that you can best serve the families under your care with evidence-based practice solutions, easy to implement advocacy approaches, and new ways to lean into your skills within the challenging pediatric landscape. Hello, today I'm excited to be joined by Nicole Schwam, occupational therapist, who is an expert in the area of cardiac conditions and cardiac care in pediatric occupational therapy. We'll be diving deeper into this topic, including recent research and actionable takeaways you can implement right away. Welcome, Nicole.
Hi.
Could you get us started by sharing a little bit more about yourself?
Sure. So first thing I'd like to say is that today I'm going to be representing my own personal individual experience as an occupational therapist who work with infants and toddlers with congenital heart defects. I'm not representing NYU Langone, who is my current employer. So as I said, I'm here to talk about infants and toddlers with congenital heart defects. So I've been working in New York City for about 16 years as an occupational therapist, and I've been working in pediatrics for about 15. I've been able to work at various hospitals within New York City, and I've worked in inpatient hospital where we work in acute care with pediatric ICU, cardiac ICU, worked with children who are undergoing cancer treatments. I've worked with kids who have underwent orthopedic and neurosurgeries. And I've worked also in the setting of outpatient and early intervention. So I'm really excited today to talk about this topic because it's something that I love. And I really want to make sure that we continue to help the children as best as we can as occupational therapists. And I wanted to just tell everyone that I'm actually working on validating clinical guidelines for pediatrics cardiac care for children 0 to 5, and I'm going to be doing that hopefully within the next year or so.
Oh, wonderful. That will be really helpful. So, knowing that you're working on these clinical guidelines for cardiac care, tell us a little bit more about what initially attracted you to this expertise of cardiac care and working with this population in occupational therapy, and how your passion for this topic or treating this population has evolved over time.
So I actually first became interested or even just understanding the role of occupational therapy in cardiac care when I went into OT school. But when I was younger, I actually was diagnosed with a heart defect and I had actually a heart condition. So during the physical fitness test, when I was in middle school, I had this episode where I had this racing heart and shortness of breath. And they thought for sure it was asthma because it had happened during an activity. So I went to a pulmonologist. They gave me an inhaler, but I kept having these episodes. And sometimes it would happen during sports and activities, and sometimes it wouldn't. So I kept going back to the pulmonologist, and they determined that I actually didn't have sports asthma, and it was something else. So for the next 8 years, they tried to work me up for some kind of heart defect. And I worked with a cardiologist and, but I kept having these episodes of heart palpitations, shortness of breath, and I would get really dizzy and sometimes almost pass out. I was very active and I liked to participate in sports, and I was on different sports teams. And I was always scared that I was going to have one of these episodes during these activities. And I felt myself limiting what I did, where I did it, what I would do. So finally, after multiple Holter monitors, which measured, which would measure basically like a portable EKG, would measure my heart rate. They found nothing. They gave me this portable device called a heart card. And I had one of these episodes and I put it on, and immediately within a short period of time, they diagnosed me with supraventricular tachycardia, which in and of itself is not something that in general it can be really scary. And there's definitely some times when it can be very, it can cause a lot of other challenges. But what ended up happening was I didn't really understand the risks of what this could do to me. And I really didn't know what to do. So they put me on a medication first, and it basically would reduce my heart rate overall. But that was really not working. And I didn't really want to live on a medication. So over time, I kept isolating myself and I kept not engaging in different social activities. And I decided that I needed to undergo a cardiac ablation. And that way they could stop that extra electrical circuit, which was causing my supraventricular tachycardia. And it was really the only way I was going to get back to my activities. And so I found a physician who actually did the procedures on very small infants. And I figured if he could do it on a very small infant, he could do this procedure on me. And once I had this ablation, I was back to normal. I wasn't scared anymore. I wasn't having any more of the episodes, and it was great. But once I was in OT school, I really started to put those connections together about what I did to limit myself, and then what these infants and toddlers and even other older children are going through when they're experiencing heart difficulties and different diagnoses, cardiac diagnoses that are actually much more serious and can have long-term effects. Once I had this procedure done, it really helped me get back to all my normal activities and do all the things that I wanted to do because I wasn't scared anymore. But I realized once I went into OT school that there are all these children that have these really severe conditions, these cardiac conditions that have some long-term effects, have profound long-term effects on their ability to participate in their daily activities. And one of the things that was really kind of pushed me is that I was working in the hospital, and it turned out on the cardiac ICU when I was working with some of the children, it turned out that the electrocardiologist who had actually performed my procedure was working on that unit too. And so it really kind of just brought everything full circle and really just kind of highlighted how important this area of practice was for me. And this was really why I wanted to develop some kind of guidelines for children with congenital heart defects.
Wow. I mean, this is a really personal connection for you. And I want to thank you so much for sharing your story. When I said earlier, what is your passion with this topic? You really have this personal connection that is quite profound. I love that it went first full circle with the surgeon that worked with you, that you ended up learning from that surgeon and working with that surgeon as an occupational therapist. So I think it's really, interesting to think about this population for a lot of therapists because we know it can be a little bit intimidating. So for pediatric practice, why is this such an important area, cardiac conditions and cardiac care, for us to really think about moving into this role as occupational therapists?
Well, one of the biggest things is that there's been significant advancements in cardiac care and really surgical interventions that have improved the survival rate of these children. They still undergo these really extensive surgeries, and they often which limit their ability to perform daily occupations. And it's really necessary for them to have intervention earlier to remediate some of the developmental delays that they're at risk for. There's really two types of congenital heart defects. One is acyanotic, which is really characterized by one structural abnormality of the heart that obstructs the typical blood flow that's within the actual heart itself. And these are considered not as critical. as a congenital heart defect, and then there's cyanotic congenital heart defects, which are considered critical. And these reduce the amount of oxygen that's actually supplied throughout the body due to the abnormal anatomy of the actual cardiac system itself. So it's really important as occupational therapists that we understand the structural abnormalities and the various medical interventions that these infants and toddlers experience, because the research and the CDC has stated that 50% of the children with congenital heart defects are actually in special education.
Okay, so that's something I did not know. And that just tells me that there's a lot of opportunity here for occupational therapy to work with this population. So Nicole, what questions should we be asking as practitioners who work within this population or in clinical context where we're going to be working with kids that have heart defects or cardiac conditions? Is there anything that we should be questioning in this process?
So we really have to ask ourselves, how are we going to foster their development? What experiences are we going to provide that are going to help them develop all the skills that we want, but also understanding these medical complexities and the cardiac conditions that these children are experiencing? Many times the children with the cyanotic heart defect, their anatomy is atypical, and they go through these surgical interventions that are often staged, and they need multiple versions of surgeries as they grow throughout early childhood. So it really has a profound impact on their ability to play, to move, to explore, even to engage in feeding. And then what kind of impact does this have on the actual family and the family unit? Some research really has, pushed in other areas, early detection of different diagnoses is really important. And we really need to know what is going to be the possible impairments for these children and how can we detect it as early as possible. And so frequently have to be using early intervention and school-based therapies as a way to address some of these delays that these children experience. But a lot of times therapists who work in those areas don't always get that opportunity to really understand the medical side and the medical interventions that these children have gone through. We know that more infants and toddlers, especially since 50% of these kids do require special education, they'll be using early intervention and school-based services. So it's really up to us as clinicians to educate ourselves on the medical conditions and the complexity and how that impacts their ability to engage in occupations.
Mm-hmm. I guess I was initially thinking of more of the ICU or inpatient side of things, but now you're opening my eyes to say occupational therapy is going to work with kids in all different arenas, whether it's school-based OT, whether it's outpatient, whether it's home health, as well as those more acute phases of rehab. So this is applicable to a lot of people. And I think that idea of understanding the medical complexity will help with some of that feeling of intimidation with working with these kids. So you had said that there's a lot of research happening in this with this topic or with these conditions. So what does the recent research say? Can you give us some highlights of the most important takeaways to help guide us?
Sure. So the research in general really focuses on identifying the risk of delay. So a lot of the research out there has identified that these children have frequently motor delays, cognitive and language delays, social emotional delays, and then issues sometimes with like engaging in adaptive tasks. There are some guidelines that were provided just about like the global process and how monitoring and screening needs to happen for these kids. But it doesn't really direct us as therapists and us as occupational therapists of what to do and what our role would be in the care for these infants and toddlers. The American Heart Association actually identified severity of the risk of delay in infants with congenital heart defects, and they have some criteria for therapists and clinicians who work with these kids just about how to rate the severity. But it really, what they identified is that you need to have periodic surveillance to assess if these neurodevelopmental delays are going to happen. But what happens when we do identify that they are happening right now? And that's really why I wanted to make sure that we could have some kind of guideline as occupational therapists so that we know what to do.
Because it sounds like there's a lot of comorbidities that can result, and we don't really know chicken or egg, which comes first.
Yes, because some of the research has shown that there have been some brain abnormalities and some studies that do show cerebral changes on MRIs with these kids. And it's also as a risk factor for kids for autism and ADHD as well. And some of the studies have found that autism actually, the risk of having it doubles with infants with congenital heart defect as compared to their peers. So, it's really important when we're working with these kids to also think about the physical activity that they're engaging in. As I mentioned, kids with congenital heart defects, especially cyanotic type, they're living with these oxygen saturations that are not typical like you and me walking around. They're living with these ranges of oxygen that is constantly below the level of what we would normally need to function. So what does that do to the developing brain? And, there's been a lot of research that has shown that there has been some evidence of cerebral changes. The other thing is since we have to think about the physical activity and how the kids engage in motor tasks, we also have to help them over time as they get older, learn how to monitor themselves. Because a lot of times, since there are staged surgeries, these children and families really need to be educated on not only symptoms of, when they need to seek medical attention, but also how hard and can I push my child, right? Frequently families can be really nervous about.
Yeah, that's, I think, probably a little bit of that intimidation for the therapist as well.
Yeah.
How hard to push, right?
Yeah. But there really hasn't been a lot of research out there that really shows the efficacy and what therapists can do. There's been a few studies that kind of look at physical therapy after surgery, which we know globally, any kind of therapeutic intervention after surgery definitely promotes better outcomes and more engagement and function. But there's nothing looking specifically at these kids with congenital heart defects and really guiding a therapist on how to treat them.
Yeah, so that's the trick, right? We need more of that coming from occupational therapists. So you talked a little bit about the family and how they're concerned with how hard to push them. Is family-centered care an important part of this puzzle? And what does the research say?
Yeah, so there has been research out there that has shown that the environment itself has a profound impact on the long-term outcome of developmental skills. And actually specifically with kids with congenital heart defects, often they also find that children, depending on the length of stay, in the hospital has a profound effect on the outcome of the developmental skills later on. So it's really important for us to educate parents and caregivers about what is really essential and what do we need to do as therapists, and then really can make that connection to what they can do at home and what they can do in the child's natural environment, because we really want them to be able to engage in all environments as best as they can. And we have to really look at that. What is our role in providing that education to the families and really looking at how does this change within their family unit because their child maybe has this condition? How is this changing what their day-to-day life is like and their quality of life?
And I love that because occupational therapists, we are very honed into environment and context and how that influences participation in occupation. So that's an important piece of the puzzle. So you started to do this already, but it seems like there's a little bit of research out there. There needs to be more about the efficacy piece. But how are we going to translate what we have found in research into practice? Can you share a little bit of that?
Sure. So one of the things which I know I kind of stressed before is really looking at the medical conditions and the medical complexity themselves, and what can OT do that's going to help improve developmental skills and help them engage in their age-appropriate occupations. It's a lot of times, it's really important for us just to understand the anatomy, understand what is going on pre-surgically, what had happened post-surgically, and then what other precautions or activity limitations they might have in that immediate time right after surgery. But then also, what do we have to be looking at to see how they respond to our activities? So we really have to be looking at the physiologic response of the children as they're engaging in our therapy, but also how is that going to translate to typical activities that they do at home? The other thing, which we kind of mentioned before, which was family-centered care, right? We need to constantly be educating families and provide them with the interventions that are the safest and will promote engagement in age-appropriate activities. These families, we have to really focus on the occupations that they do on a day-to-day, in addition to what the children have to do. So it's important for us to provide that education that's going to promote that motor development, that cognitive development. How are we going to engage them with improvements in their communication skills? And then also, we want to make sure that we help them build that reciprocal interactions, because that's going to really promote that social emotional development, which we really want to see with these kids. Often, the children have been through so much and they've been in and out of the hospital, and it can be really challenging for the families because they've watched their children go through so much. And it's, they sometimes are able to pick up on their children's cues, but sometimes, they're watching constantly to see what's the next step and what is the next step in their surgical plan, that, we want to make sure that we're constantly telling them and teaching them about the physiological cues that the child is experiencing, but also those emotional cues that they're giving off as well.
Yeah, the mental health side of things, I think, is sometimes maybe underutilized in the situation. And we know the long-term care, they're starting to now talk about it being almost like PTSD for families and for the kids involved. It's not really been considered that before. So I think I like that you're really focusing on that social emotional piece and the mental health of the family.
Yeah. I think as OTs, we're really uniquely situated to address really the long-term consequences and the long-term effects of these disorders and how it really influences occupations, because we're really good at modifying and adapting things, and we're really good at doing things that are going to help really promote quality of life. And that's really our main role as OTs, is to promote quality of life and engagement. And, we have to provide the interventions for the infants and children, but we also have to ensure that we're constantly, when we're doing that, watching these physiologic responses as they're doing their daily routines, so that the families understand their cues better and really look at their energy reserves. Because the energy conservation is another area that OTs really strive in, because we're really, like I said, great at adapting. So I think that looking at that activity tolerance, looking at the energy conservation and the cues that the baby and the toddler is giving us really plays a role into what we know is going to be the next best things to promote at home.
Mm-hmm. Yeah, I think that would really help to reduce that anxiety and stress of the families. I could see having some monitoring forms or something for the families so they could really start to see trends over time. So that's a great way to take that into practice. So what do practitioners need to consider when it comes to the perspectives of other stakeholders, the family, the kids that we're working with, maybe some of the other therapists for interprofessional practice? Are there some talking points or strategies that you would suggest to aid in some buy-in and carryover? Because we know that if the family's stressed, we know they have day-to-day challenges. They're kind of maybe having multiple kids and, they're having a child who's sick. We have to really hone in on that buy-in to get the carryover and really meet families where they're at. So do you have some suggestions on how to do that effectively?
So I think what we have to understand is that each clinician is going to have different priorities, right? The physical therapist is going to have a different priority than the OT. They're going to be focusing more on just that, the physical and the motor, right? The speech and language pathologist, they're going to be focusing a lot on feeding, which is really critical, especially in the early infancy. But also eventually as the children get older on like language and communication and some of those cognitive skills that go along with it. While the medical team is really going to be focusing on like maintaining the stability and also hoping to promote the growth of the child in preparation for other medical interventions or surgeries that might need to happen later. So we really need to think about what is OT's priority. And I think our priority is going to be really looking at improving engagement and improving the participation across the board to increase functional capacity. And I think that's like critical for us as OTs to really understand what our priority is that might be a little bit different from the other clinicians that also work with these infants that are super important. We also, as OTs, really do a good job of looking at things from the client-centered approach and really looking at the interventions that are meaningful to the family and to the client and patient. It's important that we don't want these families to really be overwhelmed because they've already been through enough and they might be going through more in the future. And so it's important that we provide them with that social support and that the education so that they know exactly how to play and enjoy the child and play and engage with them, but also how to care for them. And we need to make sure that we show them what the real life benefit of our intervention is. Doing this activity will help your child do what? And that's what we have to make that real life connection with, is really explaining to them that we're going to do this type of task. We're going to do this activity. You're going to play with your child this way, and it's going to help them do this in the future. And I think when you put it in those real life terms for them, you get a lot of more buy-in and they understand the importance of OT globally. But it also allows the family to be included in the process, right? We want them to be there with their children way more than we are. And so they're their primary playmakers, basically. And so we really want them to feel comfortable playing with them and playing with them in the safest way possible so that they can really enjoy the time that they have with their children. We also have to make sure that we try to make it intervene as early as possible. We know the earlier we intervene with a lot of these kids who are at risk for developmental delays, it has a profound impact on the outcome later on in life. And I think that we have to really look at what our significant impact would be on the long-term skills of these individuals as they continue to grow and thrive over time.
Mm-hmm. I love the celebrate the small wins, right? And that the parents are the primary playmakers, and that doing this activity will help your child do blank. Because I always say occupational therapy is the doing therapy. So I love that you're carrying it forward to the family that way. I think that's a great strategy. So I like to kind of condense all this for the therapists that are out there. They're taking in all this information about these cardiac disorders and thinking about how to work with these families. So talking maximum impact, what would your top 3 actionable takeaways for practitioners to put into practice? What would they be?
So I think I would say we really want to educate ourselves. We want to educate ourselves about the medical procedures. We want to understand the anatomy and the structure of the heart. But then what is the atypical condition that we're seeing? What is the atypical structure that these children have and might be living with currently? It's, really important because it guides our ability to foster development, because we need to understand where they started from. And so that we know safely how to engage them in their occupations in the future. The other thing is always kind of looking at the quality of life, looking at what the occupations that we can help them participate in that's going to improve the quality of life while doing it in the safest manner possible. And then I'd say the third thing is we, as OTs, really need to advocate more for us to work with these children in all practice areas. I think that we don't always realize that maybe some of the kids we come across in other areas of practice, such in schools, maybe have underwent some of these different surgeries or maybe has this history. But we need to understand, again, where they started from and what they went through in that early childhood, early infancy, and how that's going to have an impact on things globally as they get older.
Yeah, that's some great advice. I think we underappreciate the long-term impacts of what these kids maybe had gone through early on. When we see them when they're older, I know I typically treat older children, and that might fly under the radar a little bit. So I'm glad that you brought that up because it pushes us to look deeper into their medical history and understand the implications and the long-term effects. So, normally, we might talk about what's a success story. And I know you probably have a bunch because you've been working with this population for a while, but I think because there's such diversity with this group that a success story might not be as helpful as taking the process of implementing cardiac care for pediatric clients and helping us understand that clinical reasoning process so that it's maybe not as intimidating for those who do want to start working with this population. Can you share that process with us?
Sure. So typically when I'm going to evaluate or even treat a child that maybe has already underwent an evaluation by an occupational therapist, I want to basically go through these different components. I really want to understand the medical timeline. I want to know what is the type of disorder that they have, what surgical interventions they've underwent, which ones might be happening in the future, if that is part of the plan, and then what is that anticipated timeline, so I know when I should maybe expect that the child might need a change in plan of care. I'm going to try to understand what type of congenital heart defect it is, but I'm also want to understand the medical course because it's going to guide my treatment plan and it's going to guide my frequency of care recommendations. And then I want to know if the children have been hospitalized for prolonged periods of time, because as I stated before, we do know that sometimes the limited exposure to typical environments can have a prolonged effect on the developmental outcome later on. So we want to know how long that hospitalization has been for, and what other precautions or limitations did they have, like sternal precautions or cardiac precautions, and how long that has been going on for.
Is this where it would be important to know acyanotic versus cyanotic?
Yeah. So
you discussed earlier? Okay.
Yeah. So you would want to really kind of understand because cyanotic congenital heart disorders, they're critical disorders, and they frequently have more long-term effects on development just because the nature of the diagnosis itself. There's so many different types of these disorders, and each one is so variable, and each child is a little bit different. But we really need to understand those, the actual structure and anatomy of where they started from pre-surgical to where they are right now in this in-between surgically. Also, whenever I'm working with them, I want to make sure that I'm assessing vitals because it's really important for me to understand the physiologic response to the activities that I'm going to be having the children or the infants participate in. Working with these kids can be really scary at times. We do not always know how they're going to react to the activity or to the position we put them in. And so it's important that we're constantly monitoring their vitals and watching for their cues of what is happening. Sometimes it's going to be a color change. Sometimes that's going to be increased work of breathing or increased respiratory rate. And so these are all signs that are going to tell us that the child is tolerating something or not tolerating something. And then after I'm getting some of this information, I'm going to really interview the parents because I really want to know what their daily life is like, right? Because we know that that the baby has a schedule. The baby does something every day. They participate in something and the parents are trying to take care of them. And so we really need to know not only what the restrictions are from the cardiac team, but what does the actual care for this child look like? What positions are they putting them in? How are they playing with them? What toys are they playing with? How are they feeding them? How are the child sleeping? How are they dressing them? Do they get upset when we change their diaper or, change their clothes? Do they like bath time when they're allowed to bathe? Those are all questions that I'm going to want to ask and try to understand, because this is going to help me know what the child's environmental context is going to be like. And then I always ask, have there's been any kind of tasks or activities that they've done where they've noticed a change in color, or if they are monitoring the oxygen at home, have they noticed that there's been a change in the oxygen saturation or anything like that? Because that is something that's key for me, because I'll want to see how the child is responding to an activity like that. And so that I can, one, contact the medical team, but also make sure that if I put them in those positions too, because it's age appropriate, what might I see? After we go through the interview, frequently for an evaluation, I'm going to choose some kind of developmental based assessment. These are obviously critical because it's going to really tell me what the child is doing right now. But I also want to give the parents some kind of patient or family reported outcome measure as well, because this is going to tell me a little bit about what the family is doing and also how they're doing and how they're coping with some of these things. And then obviously, as I'm doing this assessment, I want to actually assess their developmental skills, really kind of identify what their current functional status is, because that's going to tell me where I'm going to start with my interventions, is seeing where their current status is. I also like to provide families with some kind of sensory-based assessment. I think it really helps us understand the infant's regulation, and then the way that they're processing sensory information. We know that infants and toddlers, very sensory driven. The first way that they engage with the world is through the senses. And so they've been through a lot. They've experienced a lot of frequently a prolonged hospitalization or some kind of surgical intervention. And then how did, in that early infancy period, so what does that look like for their actual sensory processing, since they've maybe been restricted in doing some of their activities or didn't have the endurance to engage in some of these activities? So throughout that entire process, when I'm looking at sensory, I'm also looking at things, how to facilitate play while continuously monitoring their physiologic responses to the things that are happening in the environment and also with the activities that I'm choosing.
So these 4 steps, and I know there's more, but these 4 steps that you've gone over are really typical of what we do as occupational therapists anyway, except they have the assessing vitals embedded in there. They have the looking for the cues related to color change, breathing rate, the vitals, and things like that, the activity tolerance embedded within the process, and then appreciating that they've had this environmental and, prolonged hospital influences on their developmental progress. So I think it's important to highlight, this is how we normally evaluate kids for the most part, but now you have that medical piece at the very beginning that's very important, and then we're layering in how to monitor related to their diagnoses. So I think that's, hopefully eye-opening to folks that we know how to do this, right?
Yeah. We, as occupational therapists, we do know a lot more, I think, than we give ourselves credit for. And I'm definitely one of those people that does that sometimes. But we do know the general processes. I think it's just making sure that we apply that process to the medical conditions that we're seeing in front of us. Mm-hmm. And I think sometimes we're so good at looking at ways to, engage different people and to cross the different practice areas in their occupations, but we're not always looking at, that the medical side of things and the medical conditions that they're experiencing. We understand the symptoms, but then what does that really mean for the activities that we're trying to engage them in?
Right. And so having those baselines too, and that medical understanding is important. So I know you were getting ready to say the fifth point in your process about educating the family.
Right. So once I, pick up on all their cues, or as many cues as I see during that time frame, because, I'm getting a snapshot, I then want to make sure that I'm educating the family on what I observed. What did I see? And then so that I know what I want them to focus on. But I also want to make sure that I'm describing all the positive things that the child is doing, all the things that are really that's really making the child, happy to engage, things that, the toys that I see that them like, and, what things that I'm seeing that are, really positive developmental skills, so that, I'm not constantly just looking at, all the things that maybe they're not doing, and not so much focus on what they're not doing, focusing more on what they are doing. And it's okay to really discuss your observations, but you just want to make sure that you relate them to what you're working on and what you can do to help, So even if you see something that you're a little bit concerned about, we want to be transparent with the families, but we also want to explain to them what I can do as occupational therapist is going to help remediate that symptom or that development, the skill that they're maybe lacking at the moment. Mm-hmm. So with that, because I really want to focus on a lot of the positive, I also want to create goals, and I want to do that with the family. I want to have that collaboration. I want to make sure that I include the family in the process so that they know what we're working towards. It's really important because you want them to continue to facilitate the activities and the play-based tasks that you want them to do. So it's important that you include them in your process because it's going to help you see the change and help them see the change and really enjoy their child. And then really after that, I'll start to talk about what my plan is going to be as an OT and what my frequency of care is going to be. Sometimes this can be a combination of in-person visits, depending on the child. Maybe it might be also telehealth with a combination of the in-person. And, a lot of times these kids are referred to early intervention. So we can use early intervention to help supplement some of the things we maybe are doing in the outpatient clinic. But we want to make sure that we're providing access to occupational therapy as best as we can for these families. And sometimes that might need to be in person, and sometimes that might need to be telehealth. And then the final part, I really when I'm trying to come up with my whole care plan and plan of care, I really want to look at what interventions I'm going to be using. And we have to remember these have to be client-centered. We want to look at things from the developmental standpoint. We want to provide sensory experiences. We really want to look at positioning for different OTs who do work in feeding, or we want to make sure that we provide feeding support. But we also want to ensure that things are play-based. But through all those different intervention strategies, we want to make sure that we're looking at any kind of activity modifications we need to do depending on the physiologic response of the child. And then we want to make sure that we're constantly looking at some energy conservation as well.
And then those cues and safe play, like you talked about with the parents earlier, and teaching that and making sure they're very attuned to that with the client.
Yes. Really helping the parents pick up on the children's cues is really important because that's going to make them feel really comfortable with doing some of the activities and the play tasks that we want them to do, because we want to really normalize the childhood experience in the infancy for these children. We want them to be able to play to the best of their ability and explore so they continue to develop skills over time.
Yeah. And that's why I love being a pediatric therapist. Play is where it's at, right?
Yes.
And what a gift to be able to work with these families and help them play with their kids. I mean, that's really, I think, why people love being pediatric therapists. When we see the play just start to, explode with these kids. And so it's really exciting. And to know that we're facilitating that safe play is truly a privilege. So I love that you went through all those 8 steps because, like I said, these are things that we know as OTs. These are things we know how to do, but layering in that medical understanding of the complexities of these diagnoses, the surgical course of action, as well as the recovery process, and learning those cues so we can push at the just right challenge. I think those are the scary parts, but it sounds like it's completely feasible if you educate yourself and start to work in this arena and learn as you go. So I hope that this kind of, it breaks down some of those barriers that people are experiencing to work with this population. And you've given them some really great ways to think about working with cardiac clients and their families. So I want to thank you for that.
Thank you. Thank you for having me. I feel like I also really want to stress, really, whenever you're working with these kids, especially if they're, are recently underwent some kind of surgery, you want to be in constant communication with the medical team. It's going to be really important that, that you're updating them on how the child is performing, updating on, how the child is tolerating some of the therapies. So that interdisciplinary connection, not only with the other therapists that are working with them, but also with the medical team is really critical.
Mm-hmm. That lifeline is key. Thank you for adding that. So to wrap things up, do you have some final words of wisdom or inspiration that you could leave with the audience?
I think what I would want to say is that as occupational therapists, we have this opportunity to promote independence and promote function, but we also have this ability to really look at what is going to improve quality of life. And I think that we frequently, with infants, especially infants who have underwent some of these medical complexities, we're kind of nervous to figure out ways to promote that quality of life. And I think that, there are these really great interventions that we learn that I think that can be applied, but we really need to ensure that we understand what the child has gone through before this, what is going to be the long-term surgical plan, but then what does the family want as, or what do they see as what they think quality of life looks like? And I think really looking at what the family perceives as quality of life is that next step that us as occupational therapists need to take.
Mm-hmm. I call that the occupational vision, right? What is your occupational vision for your family, for your child? And so much of what we do is actually interdependent. So with the family, it's fun to work on that. So great words of wisdom for us to take away. So, well, that's all the time we have for today. And I want to thank Nicole Schwam again. She's truly a pediatric pioneer, and we appreciate her clinical takeaways related to pediatric cardiac care. Thank you, Nicole.
Thank you.
Thank you for tuning into this episode of Pediatric Pioneers by MedBridge. Please be sure to subscribe and listen to more of our episodes on Spotify or on your favorite podcast platform and at medbridge.com. If you're listening outside of the MedBridge catalog and would like to access the bonus resources and receive continuing education credit, simply log into your MedBridge account and complete the quiz for this episode. Pediatric Pioneers also listens to you. If there is a particular practitioner that you'd like to hear from, or if you have a question or challenge that you'd like to explore on this podcast, please let us know by leaving a comment on our Instagram post or by emailing podcast@medbridge.com.